My name is Muriel Pulido. I'm majoring in Health Service Administration. This is my capstone final project. It's a paper regarding the clinical and financial impact of hospitals' readmissions. My teacher of this capstone class is Dr. Christopher Miller. I will be discussing about the clinical and financial impact of hospital readmissions. The readmission will result in providing extra care and service for their patient, and it incur more administrative costs followed by more clinical costs. This topic is important because the patient needs to undergo through more detailed clinical tests, and there will be more costs associated with it. The readmission showing the incapability of the healthcare and will deteriorate their value system and credibility in the market. Almost nobody likes to be sick or ending hospitalized shortly after being discharged. However, 1 of 6 patients with Medicare return to the hospital within 30 days for a medical condition. Many of these readmissions are considered avoidable because generally they are due to patients not following their medical instructions. There is poor coordination and communication in the system, and the patient has not understood what must to do to maintain his health. In fact, it is very important that patients and healthcare providers communicate clearly, so all the questions are answered and everyone understands what will happen when the patient leaves the hospital. But it's not only the patient who does not want a hospital readmission to the medical plans, to the hospital either. In fact, it has been proven that most patients who are readmitting require service that are not profitable for hospital. Therefore, there should be a good coordination of all involved to reduce the chances of readmission. A good discharge plan and good communication between patient, doctor, nurses, and family members and others who are involved in the transition from hospital to home is key. The hospital administration is a specialty of the health administration, focused on the autonomy and the management on services and hospital institutions. Several features distinguish current health programs. The correct way in which administration can avoid hospital readmission is by creating a high-risk plan. For example, those patients who tend to make frequent flyers in hospital, give them alternative. There are patients who are compliant with their medications for many reasons. These organizations can create chaos and a decline in the health of the patient. For example, a nurse can go to the patient homes, check their medicine, take their vitals. In this way, the administration is preventing the patient has a relapse after being hospitalized. With an electronic system well implemented, administration can divide high-risk category. For example, the high-risk and medication management and high-risk the medical management. Hospital readmission is a phenomenon where the patient who has recently been discharged must get admitted again in a short span of time within a close interval. The contributing factor is lacking perfection in delivering treatment that doesn't result in completely abolishing the system, and it makes the illness prevail. By adopting monitoring technology and partnering with solution providers, patients can benefit and hospitals can also reduce the cost of readmissions. Finally, it seems relevant to comment that considering the results presented and the limitation previously discussed, early readmission would be related mainly to the characteristics of the disease. In everyone, and a group into disorders by their nature tend to be more chronic and with the tendency to relapse, recruiting the placing the type and severity of the pathology as the greatest predictors of readmission. The information of alliances with primary care physicians to address the issue of readmissions and collaboration with other hospitals to develop current strategies to reduce readmission and 2 other beds. I want to conclude by stating that communication between doctors, the patient, and the caregivers plays a leading role in the coordinated management process. Thank you.